Hi, you've just learned about the steps of giving injection. And now, let's discuss about how to apply the IV infusion. Are you ready? Okay, let's go. The first step is this. Can you look at the picture? Hang the IV container on the IV pole. Once again, hang the IV container on the IV pole. And then, second, remove the protective cap of the container. Remove the protective cap of the container. Next, insert the tubing spike of the chamber to the opening of the bag. Insert the tubing spike of the chamber to the opening of the bag. And then, after that, squeeze the chamber. Once again, squeeze the chamber. Okay, you need to squeeze the chamber to let the fluid from the IV bag entering the chamber. And then the next step is open the clamp by rolling the roller clamp to see the run of the fluid through the tubing. Once again, open the clamp by rolling the roller clamp to see the run of the fluid through the tubing. And after the clamp is opened, then flush the tubing to expel the bubbles, then close the clamp. You must make sure that there isn't any bubbles in the tubing, so you need to flush it. And after you flush all the bubbles, don't forget to close the clamp. And then let's continue the after you close the clamp and then you lift the tubing and perform venipuncture. Perform venipuncture on the patient's skin. It can be on the hand. What else? On the legs, on the neck, and etc. Lock the IV tubing to the angio catheter by advancing and rotating. Lock the IV tubing to the angio catheter by advancing and rotating. After that, you may reopen the clamp. After you connect the tubing to the angio catheter, you may reopen the clamp. And as the last steps, just adjust the desired flow rate. Adjust the desired flow rate. It's easy, isn't it? So, when you are going to apply the infusion to the patient, of course, you need to have communication with them. You need to tell them what are you going to do, and you need to explain the procedure of the treatment that you are going to give to them. So here are some useful expressions in applying IV infusion. Let's check it out. Now, first of all, before you apply the infusion, you need to tell them what are you going to do. So you can say, it's time for me to apply this infusion. Once again, it's time for me to apply this infusion. And then you need to explain the procedure, right? So you can say, I just want to give injection into your vein. I just want to give injection into your vein. Then, when you are going to apply the tourniquet, you can say this to the patients. I'm going to apply this tourniquet around your arm. I'm going to apply this tourniquet around your arm. Or maybe sometimes you need the patient to lie back on the bed. So you can say, would you lie flat on your back, please? Would you lie flat on your back, please? Then, if you need the patient to uncover the arm, you can say, please roll up your sleeve. Please roll up your sleeve. Please roll up your sleeve. Okay, and then next, if you need to hold the patient's hand, you need to ask for their permission first. So you can say, now I want you to give me your left hand, for example. Now I want you to give me your left hand. Or now I want you to give me your right hand. That's okay. Right. While you give the treatment to the patient or while you have communication with them, maybe there are some questions that they often ask. For example, what for? What is it used for? Sometimes they will ask, what for? What is it used for? They are curious about the purpose of the treatment. So you must explain it to them. How? For example, this is the example of the response. To make medication easier, I need to give you the infusion to make the medication easier. Or, the purpose of giving infusion is to increase solution in your body and other rationale. Well, sometimes you need to give reassurance to the patient if they look afraid of the injection. So, to make them sure that the treatment is safe or everything will be okay, you can say, don't worry, it's okay. It won't take long. I'll do this as quickly as I can. I'll do this as quickly as I can. Have you ever had an infusion before? Or have you ever been given an infusion before? Everything will be okay. It shouldn't be painful. Right. That's all some example of expression that you may use when you are going to give infusion to the patients. If you have any question, just feel free to ask in chat room. That's all for me. Bye bye.